Item number 2 on the agenda this morning would be our COVID-19 update from our Public Health Director, Kathy McKay. Becky and Jamie are with you this morning. Good morning. Colleen, do you need me to wait? Are you okay? Okay, thank you. Good morning.
Good morning, Madam Chair and Commissioners. I'll just pull up our PowerPoint. Okay, so here is our weekly cases, and as you can see, we're seeing a marked decrease in the cases, which is good. 147 new cases from the 13th to the 19th of February, and our preliminary number for the 20 to 26, March 20th to the 26th, is 57. Now, that's a great number. We know that we'll see some additional cases as they get those all reported and recorded, so that will go up a little bit, but it's really looking good to have such low numbers in Minnesota as well. We have 8,662 new cases, so that's really declining also, and that was from the 13th through the 19th. The preliminary number so far across the state is just under 3,000 new cases from the 20 to 26. Again, that number will change once they get all the cases recorded. In Cass County, numbers are looking really good as well, 501 from the 12th through the 18th, and 244 from the 19th through the 25th of February. And in North Dakota, also declining cases, the 12th through the 18th, 2,379, and then the 19th through the 25th, 1,258. So across our metro, we're seeing great decline in cases. Reinfection data, and this is, we're counting the reinfection if someone tests positive for COVID more than 90 days after a previous lab-confirmed infection. And we anticipate the reinfection data to be as it is, 953 in Clay County, and across the state, 61,044. North Dakota has 12,883. So we know that with the Omicron variant, it was much more contagious. And people that were vaccinated had the majority of them had much milder symptoms, but the reinfection rate was still there. Here's our weekly cases by date of test. So this is from the 21st of October through today. So just as you can see, the real increase in cases in January significantly, and then now the continued decline end of January and now through February. And these are our cases by March of 2020 through current. So you can see the epi curve there on the 4 waves, the real large spike in January, and then now the decline of cases that we're experiencing. And these is the cumulative cases by age, and we've noticed all along this 20 to 24 has been the highest number of cases with the 2,163, but all of the younger ages we've been seeing large numbers of cases versus originally when it was the senior population. Total cases, 19,485 at this time. And then I'll let Becky move on.
Good morning. So this is the updated graphic from the CDC showing the level of community transmission. We're finally starting to see some color changes to this map, which we haven't seen in quite some time. Clay County is still at a high level of community transmission for this most recent data, which is through the dates of the 20th of 26th of February. I suspect that we will move down into that substantial range pretty soon, as long as our case numbers continue on the trends that they're at now.
Question, Commissioner Gross.
Who gathers this information? Thank you. Who gathers this information that we know that we're still in high density? Where do we get that information from?
So the Minnesota Department of Health reports to the CDC, and then they compile it state by state and then down to the county level as well.
And that's where they decide whether we're still red or at high level or whatever it is, okay?
Correct.
And Commissioner, oh,
Can I just follow up on that? So is that based on, that must be based on active cases and not new cases?
It's actually based on new cases over a period of 7 days. Yeah.
Okay.
So we're right at that threshold of being marked down to substantial, so I think we're
Okay.
getting close.
Anything further? Commissioner Campbell, are you through?
I'm done, thank you.
And then this is the Clay County deaths per week throughout the span of the pandemic. We did unfortunately have another death reported to us of a Clay County resident, so our total deaths are at 120. And then this is our Clay County hospital admissions per week. Again, continuing to see that downward trend. So we had 2 new admissions reported so far for last week. Again, that number will probably go up some as the data catches up. And then 11 admissions for the week prior. This is the hospital capacity information for our local healthcare systems in Fargo. Seeing a really big improvement in hospital capacity numbers as well. So at the time of this report, there was a total of 23 staffed adult ICU beds available in Fargo and 6 pediatric ICU beds available as well. Statewide, a total of 39 ICU beds available for adults and 6 pediatric ICU beds available for kids.
Commissioner Campbell.
Becky, do we have any information on what the normal statistics would be outside of a COVID world in terms of these numbers?
Like in terms of what capacity
Yeah.
normally
And
would be?
of it, no, I'm more interested in available beds. You know, we're getting these reports now, you know, as a result of COVID, but how would these numbers look like if we weren't talking about COVID at all?
And I don't know if we have pre-COVID numbers in terms of capacity, and that's something we could ask and see if that's available.
I think when we're trying to see what demand COVID is doing on the ICU beds and hospitals in general, I think that would be an interesting number to have.
Yeah, we can look into that and see if we can get that information. And then this is the North Dakota hospitalization data. So continuing to see numbers trend downward for this as well. So we had a total of 68, or there's a total of 68 currently hospitalized. That's down from 97 last week, with 11 in the ICU, which is down from 17 last week. 1 pediatric admission currently. So the graph in the middle breaks down current hospitalizations by age, and then the graph on the right shows cumulative hospitalizations by age. And then this is the vaccine breakthrough reports that the Minnesota Department of Health puts out weekly, so you can see a side-by-side comparison of our cumulative percentages from last week compared to this week. So as of the 28th, we had a little over 10% breakthrough infections throughout Minnesota. Breakthrough hospitalizations and deaths remain very low, so 0.275% for hospitalizations and 0.05% for breakthrough deaths. So continuing to see really, really strong protection against serious disease and death with these vaccines. And then this is the graph that MDH also updates every week, just showing the difference among those that are vaccinated versus those that are not vaccinated in terms of deaths. So the green line represents those that are fully vaccinated, and the blue line represents those that are not vaccinated. So you can really see how these two lines have separated from each other. So we continue to see that the majority of deaths from COVID are among those that are not vaccinated. Any questions before Jamie talks about vaccine data?
Any questions from the board? All right, Jamie.
Okay, we'll go to vaccine and testing. So looking at the slide on the statewide vaccine data through 2/24 for the 5 and over, we've actually reached the 70% mark for those that have completed the vaccine series. And again, that's the 5 and over that are fully vaccinated. not including their booster, but the initial series and the breakdown there. And then also over 2.1 million people have had that third dose and that booster dose across the state of Minnesota. And looking at Clay County, and like we state every week, we don't have all of the data, but looking at what's on the Minnesota Department of Health website, Clay County is at 61.6% over the age of 5 fully vaccinated. So some good progress on that. And then looking at the Clay County vaccines administered to date, Clay County Public Health has administered 19,271 doses of vaccine. Our clinic last week was just 19 doses, so we'll go to the next slide and look at the breakdown of that. So for the week of 2/21 through 2/25, our clinic was just in our public health office, so we just had it in our office, and we had 19 doses administered. The majority of those were 12 were the boosters, and then you can see the pediatric breakdown for the 5 through 11. First doses were 0, the second doses were 6 for that week. We'll go to the clinic plans for this week. So this week on Wednesday, the 2nd, we'll have a clinic in the Family Service Center in our office, in the public health office. And that is going to be from 8:30 to 5. So it's open for any time, you know, encouraging people to register on our website, but also we would take anyone who walks in. So we're just going to have our clinic nurse, Cheryl, there, and she will serve anyone who comes in. So we'll have Moderna first and second doses and booster for anyone 18 and over. We'll have Pfizer first and second doses and boosters for 12 and over. And then from 1 to 5, we'll have that age 5 and over Pfizer first and second doses, and then not a booster for that age group for the 5 to 11 because the booster is not available to them. We're also, which is not on our website, but we're planning to go to MSUM again at the Comstock Union from 10 to 1. We're doing first and second doses of Pfizer there and the booster, and it's open to the public even though it is at the Union for the students there. And then also offering Moderna at that clinic as well. So, and then if you have any questions about getting registered for these clinics, you can always call our office and we'll help you, but otherwise there's a link to registration on the website. And just like MSUM, we're encouraging them to register, but they don't have to register. You can show up there. Okay, so then I'll move on to looking at the testing. So the next slide is the vault testing site. So we're just looking at realizing that we have a lot of self-testing going on in our community, but it still gives us an idea of what's happening in our community with the vault testing. So we have a steady decline there. So for the week of 2/20, we had a 51.3, or excuse me, 5, I can't even see it. We'll just go to the next slide so I can actually see it. Or I'm sorry, this handout.
Right.
I really do wear glasses. Okay, so.
Got some readers.
Right? Yeah. I need readers on top of my contacts at this point. Once we get through COVID, I'll go to the eye doctor. Okay, so looking at our data here, we have the breakdown for the week of February 20th, and our positivity rate was 5.13, that's much better, down from 12.18%. And then on the right-hand side, we have the PCR test versus the rapid test. So our PCR test positivity rate was the 4.46, and then our rapid test was the 6.03 for that week. So I'll try again with talking a little bit about testing. Yep.
Jamie, those numbers are fascinating. I've said all along, I was curious about the unduplicated numbers, and specifically for the week of February 20th, when there's 12 positive on the saliva and then 12 on the rapid. I was curious. I do know in terms of the testing site, and I'm not sure if Commissioner Kaylee was going to bring this up, but she had emailed last week, had community members reach out because they had gone to the testing site and the doors were closed. The testing site was closed with no apparent communication as to when it would reopen. Kathy, were you able to find an answer on that?
Yeah, Madam Chair, I did find out that it was closed due to the weather and staff not being able to get to that site. Unfortunately, we found out at maybe 3:15, so it was later in the day that we even knew that they were closed due to weather, and of course there was no sign on their door. So I did reach out and asked if they would let us know in the future if there's any closures based on weather or any other reason.
Right, that, I know sometimes the communication between the contractor and our public health is delayed for whatever reason, but even if they were to call our news agencies so that we could have that posted on the newspaper or news outlets, yeah, sign on the door, I think it's important to communicate with people. Commissioner Gross.
Yeah, I was just gonna bring that subject up as far as knowing when we're doing testing and stuff like that. If you don't get the form, like we used to get it daily, and I know you posted in there, which is good, but if you don't get the form nowadays, and you're not really website acquainted, it's tough to know when it is, because if you talk among the community, it's amazing how many people haven't been getting their shots yet. It's just, you're talking to your neighbor or whatever. No, we haven't done it yet, and it's just, it's amazing this number is even that high, it's just, I wish we knew, I mean, I don't know how to do it either, but I wish we had some sort of way to notify everybody when the shots are being given, but I know you got it in the form and you got it on your website, but do our senior citizens like me go to the website? No. I'm sorry, I don't, it's just not done. That's my fault.
Madam Chair, so basically, we are also really encouraging people to reach out to their provider as well. And because there are opportunities at the clinics, there are opportunities in the pharmacy. So I hope that the pharmacists and the providers will be helping them with those opportunities as well. It's on the Minnesota State website for the clinics. But I understand what you're saying. It is a challenge, and I think early on we saw a lot of families helping their eligible 65-plus population to get vaccines and to find out.
I guess you should clarify that, I think if you want to find out, you can find out. So it's there, but it's just, we have to take the initiative to find out about it, and it's just, and I don't think it's done because there's just, the percentage of people that don't have it yet, it just amazes me. And I don't care whether it's 10%, 20%, 50%, we should all have it.
Thank you. Commissioner Kaylee.
Just a little follow-up to that. I did get notified this last week from Sanford that my kids were now eligible for their vaccine. Of course, they got it 3 months ago. But that is some forward momentum, at least, with some of our major providers notifying families about the kids that are eligible. But I agree with you. Our numbers should be higher than they are.
Couple more things to share about the testing. So we, at Public Health, had about 600 test kits that we were working with our newest employee, our DEI employee, that was helping to get those out to most vulnerable citizens. And then also we had 10,000 masks. So she's done a great job of getting them out to the community. But we also received an additional 10,000 test kits. So she's working to reach out. Again, our target is the most vulnerable people in the community to get them masks and test kits. And so still encouraging people to test, if they have any symptoms, if they've been exposed to someone who they know is positive, to test no more than 5 days later. And then again, if they get a negative test, to test again in a couple of more days, just basically to try to prevent that spread. So we're hoping that if we can get those 10,000 additional test kits out into the community, people will not find it easy. They're going to get together for an event. If they are going to be with someone who is over 65, immune compromised, receiving some treatments that are affecting their health, that they could test before spending time with that person as well. So 10,000 test kits are on their way out into the community, and we will be posting that on our website. We've been working with a lot of the rural communities to pick up and bring back to the community. So lots of opportunity for testing, which will help us to kind of keep things under control as well.
Commissioner Campbell.
I have just one more, going back to Becky for a minute if I can. I'm really encouraged by this positivity rate. And I know there was some discussion by some in the public that were questioning, well, is that really accurate because of all the home tests and all that stuff? Well, an awful lot of the home tests are negative tests too. And I think you mentioned that it still is a good gauge, Kathy, you mentioned still a good gauge. is the positivity rate part of what's considered for the switching from a high to a moderate or substantial in that category piece?
Yeah, that's a great question. So the CDC does use that, but we haven't followed their positivity rate that they list for Clay County because we've never been able to get a full picture positivity rate because so many of our residents are tested in North Dakota, and North Dakota does not report negative results to us. So that's something I can look into and see what the CDC has listed for our positivity rate. But we've just been using the new cases over a 7-day period for that. Yeah.
Anything else?
No, thank you.
Commissioner Kaylee.
Thank you, Madam Chair. Last question. At the vaccine clinic that'll be at MSUM, will there be flu vaccines there as well, or is it just the COVID vaccine?
You know, we're offering vaccine in our clinic for all of the COVID clinics, but I don't believe we plan to bring it there. But if that's your request, I will ask Cheryl if she can certainly bring that along.
I think we should.
Okay, will do. She'll be happy to do that.
Madam Chair, one more, because Commissioner Kaylee, you asked about the schools and what they're seeing last week, and we did meet with the largest school district. The other superintendents had other obligations, but numbers were really, really great as far as numbers of kids and staff at the Moorhead School. So he reported just they're really seeing low numbers of people that are out and quarantined, and we have nurses in some of the rural schools, and numbers are looking good as well. So it looks like everything is still looking really well in the schools.
Commissioner Campbell.
Madam Chair, these numbers are really encouraging, and I know that we need to value our public health department's time. And like we did a while ago when things really started to really improve, I think it's time maybe that we can save you these Tuesday morning times and coming here, as far as I'm concerned, and then maybe you can still provide us with the reports on a weekly basis, and as long as things are remaining the outlook is this good on this, I think we could probably save all your time and being able to do other things than to be here for this.
Commissioner Campbell, I appreciate that you brought that up. I think that over the course of the pandemic, which is now 2 years, there are times that our public health staff has been strained, exhausted, and I think that in times when we see lower positive cases, I think that it's really important that our staff takes a moment to breathe. And I know that it's not always fun to come to the county board every Tuesday. I appreciate that you do that. I think it would be maybe important right now in this time to take a little bit of a break, still providing information, still continuing the information to the public. But I've been observing that there is probably another wave out there at some point. Hopefully it's not until fall or winter, or maybe not at all. But we know there likely will be another time of craziness. And I think it is probably important for you to encourage your staff to maybe take some time to recover and recoup. Certainly not leaving the public in the dark by any means. But I appreciate Commissioner Campbell bringing that up. Commissioner Ebbinger.
Yeah, just as an addition, I agree, it's time for you guys to get a breather. I would like it, Kathy, for you to feel empowered if you see a problem that you think needs to be brought to our attention, that we're not going to feel usurped at all if you get on the agenda and come back of your own volition. As so often in the last couple of years, we trust your judgment in these matters, so.
Commissioner Kaylee.
I kindly request that you would come back once the littles are approved for their shot, just so we can get updated information on that.
Are you okay with that, or would you
Yeah,
like to
thank you.
continue
No,
to
that's-
hang out with us?
We'll discuss it behind the scenes, but no, we're fine. Thank you.
Well, thanks for your work. This board certainly appreciates all that you've done.
Yeah, thank you, appreciate it.
Thank you. All right,
Thank you.
thank you.